DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson. We're going to have a great show today. Our guest, Dr. Mitch Hiscocks, and we're going to talk about something that you are familiar with if you're in the beef industry and you have cow-calf. We're going to talk about uterine prolapses. Stay tuned. It's going to be a great show. We'll be right back after these messages.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed captioning is brought to you by Profusion Drench for beef cattle, a no prescription, no needle supplement. To learn more, go to zenpro.com.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson and I'm here with Dr. Mitch Hiscocks. And Dr. Hiscocks is a clinical professor here at Iowa State University's College of Veterinary Medicine, which we're both alumni of. So it's great to have you here on the show.
Oh, thank you. I'm a big fan.
Oh, yeah. Well, we have a lot of fun. And Dr. Hiscocks brings so much experience and energy to Iowa State. He's been in veterinary practice how many years?
30
years in veterinary practice. And then, you know, I can just tell you from as a former student and a colleague, when you have somebody that'll come back out of practice to teach students, there's so much respect and just very thankful that someone would do that to share with these future professionals.
It's a two-way street. I get a lot of energy from these fourth-year students. There's a good crop. The veterinary profession's in good hands. There's some good folks coming up through the ranks. So
you bet.
It's fun to be here.
You bet. So you're with the field services and the large animal hospital here,
right.
and also with the Department of Veterinary Diagnostic and Production Animal Medicine.
Correct.
So lots of experts here. This is one of those people that if you call and you're in the area, you would come out and you would be bringing students and you're teaching and seeing animals and seeing calls.
We have roughly a 30-mile radius, and we bring senior students, fourth-year students with us out and do regular field mixed animal practice because we're mainly the food animal side of it. But
right.
We also have an equine division.
Probably a lot of haul-in too.
Yeah, into the hospital.
Yeah.
Yep.
So and that probably comes from all over.
Yeah. We have a facility 5 miles south of town that you can haul into, but our main goal is we help our local practitioners. We don't compete with any local practitioners, but if there's a need and they don't have a practitioner, then we're more than happy to serve them. So
you bet. Well, it's just continued to grow and continue to get better, and awfully proud of Iowa State University. We're going to talk about something that we don't like to see very often.
Right.
And that's a uterine prolapse, and just kind of kickstart us off what it is and.
Right. It's a 5-alarm fire. It's a true veterinary emergency. It's right immediately after calving, or it can be up to several hours after calving. But it's the organ that held the calf, the 60 to 80 pound calf, all the fluids, all the placenta, that has now made its way through the birth canal, everted outside, and it's hanging down to her hocks or possibly the ground, and you're looking at the caruncles or the attachments of the fetal membranes, and there's a lot of blood out there, and so it's a veterinary emergency. There's 2 large uterine arteries that are hanging down with that to the hocks or ground, and there's a tremendous amount of pressure on there, so it can go south really fast, so it needs to be addressed in a hurry. But
so what's the main reason why this happens?
It takes an exhausted uterus, and it takes pushing. So, if we let it go too long, or possibly we're scraped, abraded the birth canal, that will make her strain more. So she has the calf and she continues to strain. And if that organ is tired enough, flaccid enough, it can push that out of the birth canal. And so it's an exhaustion thing, and it's an irritation thing.
So a tough pull.
Absolutely.
Could
a
lead
tough pull without enough lubrication, or just a tough pull with just trauma to the birth canal, that'll make her continue to push after the calf is on the ground.
I've also learned the hard way of pulling a calf in a squeeze chute and leaving the squeeze on, and after you get the calf out, you turn around and...
Yes, you've just connected the calf with the birth canal, and you've pulled both, so that can happen.
A lot of wisdom in that last minute there. We're going to take a break. When we come back, we're going to do more on uterine prolapse with Dr. Mitch Hiscocks. You're watching DocTalk. We're sure glad you joined us.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America, a place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Innovative low-stress cattle handling equipment is key to efficiency and safety. At Daniels Manufacturing Company, we design systems using the best materials. We work with top producers from all over the world who use Daniels products on their operations. We concentrate on quality, prioritizing the safety of the animals and their handlers. Each product is carefully crafted and inspected to ensure your system will last for many years. Whether your operation is small or large, Daniels Manufacturing Company can design a facility to meet your needs. Visit us online or call to see how we can improve your cattle handling facility. Producers know stress costs money. It puts their cattle at greater risk of illness and can be a substantial drain on animal performance. That's why ZenPro developed ProFusion Drench for beef cattle. Formulated with ZenPro's patented trace mineral technology, ProFusion Drench is a no-script, no-needle performance supplement proven to rapidly replenish essential nutrients lost during times of stress. For optimal results, use ProFusion Drench with ZenPro Performance Minerals in feed as part of a complete nutrition program. To learn more, go to zenpro.com. ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Mitch Hiscocks, and we're at Iowa State University's College of Veterinary Medicine, where Dr. Hiscocks serves as a clinical professor in ambulatory services, field services, and the large animal hospital. He's also a member of the Veterinary Diagnostic and Production Animal Medicine Department. We're talking about uterine prolapses. So now you walk out, there she is.
Right.
What do we do and what do we not do when we come across a uterine prolapse?
Time is of the essence, so the first thing I would call my veterinary practitioner to get them on the way and get on their radar, because it needs to be done soon. And so when you call for help, and then I don't know where she's at, but get her to a clean, well-bedded area where you can work on her. Perhaps she's down and she just, if you can't get her up, you can't get her up. But you don't want to run her. You don't want to stretch those uterine arteries any more than you have to. But it depends where she's laying. I mean, if you can put a clean garbage bag, if she's down and can't get up, put a clean garbage bag underneath the uterus so it doesn't get further contaminated. I guess just be quiet around her and and move her to your facility where we can work on it, or if she's down, cover that thing up, put a garbage bag underneath it, or you could even take a big garbage bag and the whole thing's in the garbage bag waiting for the veterinary to show up.
Yep.
Keep it clean and moist.
And I think the one thing you mentioned, don't run her. There's a pretty important reason why we don't want her.
Right, bouncing those uterine arteries.
Yeah, because they can go over the hill and the uterus go one way and the cow go the other.
Right. Just like if you get them in a alley system and there's backstops or backup bars or something, she's in there and all of a sudden she backs up into the backstop or the backup bar, then you've created a lot of trauma, perhaps torn or ripped it. Or if you're not moving her slow enough and she's in a pen, she can swing that uterus around and catch it on the gate or a post, and there's a lot of stories over the years about things like that. Jumping a fence with a uterine prolapse, not going to work out very well.
Well, and what happens? I mean, if those uterine arteries are huge.
She will go hypo, she'll bleed out, she'll bleed to death in short order. Those are garden hose sized uterine arteries.
Yeah. So we're going to make sure we get her down, or get her into quiet, keep her quiet, cover that uterus up, but most importantly, get your vet on the way, right?
Right. I mean, hours matter here, because the longer it's out, the blood's pumping into it and can't return, so it's getting more edematous, swollen, it's drying out, it's probably getting dirtier, it's got bedding and manure and everything all over it, and the longer it's out, studies have been done. I mean, the longer it's out, the less our prognosis, the worse our prognosis will be. So she needs help pretty fast. And like I say, keeping it moist and maybe stick it in that garbage bag if she'll stand for it, or if she's down, protect it from the ground or the bedding or the dirt.
So, in a nutshell, call your vet.
Call your vet and quietly, gently move her to where she can be worked on or restrained with either in the head gate or in the halter. Knowing that exposed organ is very fragile. We need to move slow and don't let her knock that against anything, and keep it clean, and we'll wait for help.
Perfect. So that's what to do and what not to do. When we come back, Dr. Hiscocks is going to talk to us about what we're going to do to get that thing back in the cow and get her back to normal. You're watching DocTalk. We're sure glad you joined us.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEXX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idexx.com/DocTalk.
Innovative low-stress cattle handling equipment is key to efficiency and safety. At Daniels Manufacturing Company, we design systems using the best materials. We work with top producers from all over the world who use Daniels products on their operations. We concentrate on quality, prioritizing the safety of the animals and their handlers. Each product is carefully crafted and inspected to ensure your system will last for many years. Whether your operation is small or large, Daniels Manufacturing Company can design a facility to meet your needs. Visit us online or call to see how we can improve your cattle handling facility.
Dr. Nels here, folks. We're super excited about this book on hiring. Have you made a bad hire? Have you hired someone you wish you wouldn't have? Are you looking to hire? It's a great short read on helping you in the hiring process. You can find it on Amazon, Kindle, Audible, or find it at drnels.com. Check it out there. We'd love to see you there.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet. Supply.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Mitch Hiscocks, and we're at Iowa State University's College of Veterinary Medicine. Dr. Hiscocks is a clinical professor here in the veterinary production and veterinary diagnostic and production animal medicine department. He works with field services and also the food animal hospital. We're talking about uterine prolapses, and it's not something that is for the weak to fix, is it?
No, I've never weighed a uterus, but I imagine it's 50 pounds.
Oh yeah,
it's heavy, sloggy.
I just always remember when I was a kid with Dad and Grandpa being vets, my job was to hold the towel on one side and hold it up while he washed it off and cleaned it and all that.
Yeah,
and so
that's isometrics. You got to hold that for that long.
But talk to us a little bit about what you're going to do to put that uterus back in the cow.
Well, hopefully, if she's in a head gate or on the end of a halter, I mean, then we would give an epidural first, so to minimize the straining. Then we'd clean it up using water and maybe mild disinfectant like a chlorhexidine or something. Wash it up, get all the particles and the bedding off of there, and if there's loose placenta, we'd take that off of there. And then we'd, if she's down, if she's standing, that's one thing. We would have somebody with a sheet or a garbage bag or something that they make, fiberglass trays, but to hold that uterus up even with the pelvis, so you're not trying to replace it uphill.
Right.
You get even or a little higher. If she's down, then you would have her on her sternum and pull both back legs behind her, and they call that frog legging, and that makes her pelvis tilt forward, and that makes it easier too to replace. But once you've got her in position, you've got an epidural going and it's clean, then you lube up next to the cow where it's all started with. That's her cervix, is right next to the vulva.
Yep.
You've got it all up high, and you start in a circular fashion, and you can poke your hole through the uterus wall. So I mean, you want to use flat hands or fists, and you start replacing it in around the circle. Get it in there, and you'll get it down to about a basketball that doesn't want to go, and maybe you'll find the end of that inverted horn that was gravid, and you kind of go in the middle. It's like rolling your socks. You roll the last thing out as the first thing in, you roll it back in, and once it's in, then you have to make sure the horns are all the way back everted. So if your arm's long enough, you can do that, or some people talk about a clean wine bottle or even a clean wiffle ball bat or something to get those horns back everted. Or
my grandpa carried a wine bottle, and you use the big end. Don't use the. You'll poke a hole.
Right.
Going
very fragile material.
And but you'll learn pretty quick that gravity is your friend.
Yes. On
doing all these.
Yeah, because she just strains just a little bit, and all of your work comes right back out at you, and you have to start over again.
So frogging them, getting them pointed downhill.
Yep.
Different things of that nature, I've seen people too, to prevent from putting holes, actually wear oven mitts.
That's a great idea, because
wear oven mitts to reduce that.
That's a great idea. I have never heard of that, but I know if you get too aggressive, you will create a tear, and then you probably better fix that tear.
Well, these are things that are pretty common, pretty everyday, but so important for us as producers and veterinarians to get a handle on and understand. And so let's take a break. When we come back, maybe we talk about how we can try to do some things to prevent it. You're watching DocTalk. We're here with Dr. Mitch Hiscocks at Iowa State University. We'll be right back.
Some call it a come from behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Innovative low-stress cattle handling equipment is key to efficiency and safety. At Daniels Manufacturing Company, we design systems using the best materials. We work with top producers from all over the world who use Daniels products on their operations. We concentrate on quality, prioritizing the safety of the animals and their handlers. Each product is carefully crafted and inspected to ensure your system will last for many years. Whether your operation is small or large, Daniels Manufacturing Company can design a facility to meet your needs. Visit us online or call to see how we can improve your cattle handling facility.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idex.com/DocTalk.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson here with Dr. Mitch Hiscocks. We're here at Iowa State University's College of Veterinary Medicine, where Dr. Hiscocks serves as a clinical professor in the field services and in the food animal hospital. He's also a member of the Veterinary Diagnostic and Production Animal Medicine Department here in the College of Veterinary Medicine. And it's just been a great show. It's been a lot of fun and that, but is there anything people can do to prevent that cow from spitting that uterus out?
I would say overall, in a normal year, it's 0.5% or 1% of cows are probably going to do it. Mm-hmm. But I think the key is to not let her get exhausted. So early intervention, if you see a cow having trouble, check it out. And if you're going to pull a calf, a lot of lubrication, be gentle. Have your cows in decent condition, like moderate condition. Those skinny, weak cows seem like they'll throw their uterus more than anything. Calcium, they talk about calcium in the dairy world and probably in the beef world too, that lack of calcium, she's weaker, and then that toned up uterus will turn into more like a bag instead of a basketball, so she can throw that bag out.
And they have that calcium suck because of that, they go into lactation, and
right.
And so the combination of everything going on at that time. But I think you make a good point on just don't let those cows get exhausted, and they don't get them super irritated.
Right.
When do you want someone to call you as far as like pulling a calf? Because I've gotten out there where someone's tried for an hour, and now we've got edema in the birth canal, and we've got a lot of stuff going on.
I guess when you see her with her water bag out, something, she needs to advance in an hour. If the feet aren't out further than they were an hour ago, you better investigate. And if you investigate and there's a head back, something you're not comfortable with, call. It's proven time and time again that early intervention, early gentle, knowledgeable intervention will be much greater success for the cow and the calf and rebreeding. So I would say, if in doubt, call the vet, if you haven't seen advancement in an hour. What
are some of the prognosis then for these cows that have a prolapse uterus? Should we call these cows, or?
Not necessarily. Okay. If it was fresh and you got it in within hours and you feel like it was clean and it went in, they will breed back, but they might be 10% slower, or it might be 10 days. I think it's 10 days longer to rebreed or something. But if it's fresh and you got on it right away, you can keep them. Or a different topic, the vaginal pre-calving prolapse, that's different. If she does that, then she may do it again. But this uterine prolapse, that's just she got caught overly tired. She got the calf was out of position or too big or whatever, and she got herself exhausted, or she got irritated on that calf by us being too aggressive pulling, perhaps.
Well, this has been an awesome show. Appreciate you taking the time. You're very busy with your veterinary practice and teaching, and to take time to be here means a lot to us.
Oh, it's a great time. Thank you for inviting me.
You bet. Well, we'll have Dr. Hiscocks back for sure. Thanks for watching today, folks. Remember, always work with your local veterinarian. And if you want to find out more about what we do here at DocTalk, you can find us on the web at www.doctalktv.com. I'm Dr. Dan Thomson here with Dr. Mitch Hiscocks. We're at Iowa State University, and we'll see you down the road.
Closed captioning is brought to you by Profusion Drench for beef cattle, a no prescription, no needle supplement. To learn more, go to zenpro.com. DocTalk was brought to you by Merck Animal Health, the science of healthier animals. Innovative low-stress cattle handling equipment is key to efficiency and safety. At Daniels Manufacturing Company, we design systems using the best materials. We work with top producers from all over the world who use Daniels products on their operations. We concentrate on quality, prioritizing the safety of the animals and their handlers. Each product is carefully crafted and inspected to ensure your system will last for many years. Whether your operation is small or large, Daniels Manufacturing Company can design a facility to meet your needs. Visit us online or call to see how we can improve your cattle handling facility. ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.